Hello, my name is Alan Chu, and I will be presenting my Roman medicine exhibition in the form of a VR museum. Here's a huge shout out to Art Steps for helping me develop this VR tour. Definitely recommended for you guys in the future as a project. It's really useful. Let's get on with the tour. The first object I will be looking at is this plant that represents the Roman herbs. So here are Roman herbs. Roman herbs took a big part in history because Romans had such a large concentration of wealth and focus on medicine. It was used widely and herbs were infused with wine to be diagnosed. There were many famous Roman doctors and here are just a few. First is Galen. The most famous Dr. Galen, a Greek, worked extensively in amphitheaters looking after injured gladiators. He was brought to Rome and made a great name for himself, so great in fact that he was appointed medic to Marcus Aurelius' son, Commodus. Second is Cartuius, sorry for the pronunciation. He is an herb gatherer and medic who wrote a book which is now lost around the 1st century BC. Third is Mithridates. He was well known for having developed a number of antidotes, which appear to have worked and saved his life on a number of occasions. Here are some examples of herbs. Obviously, there's many more. Sage, the Roman name for the plant, was salvia, coming from the word salvare or salus, meaning health, and it was usually offered at ceremonies. Second is charlock. It was valued in Rome as an irreplaceable medicinal plant, and this has been based among 40 different medicines. Third is poppy. Its common effects have been heard about throughout the world, and Rome is an avid user of this plant. It's basically a calming plant and helps reduce pain. And parsley is Roman doctors recommended parsley due to health properties. Sterile men were advised to eat large amounts of this vegetable. Now let's go back to the actual main piece, which is the Galenic Corpus. It's a recreation of the book that the doctor I mentioned before, Galen, wrote, which amassed a lot of his studies into one book. This is a shortened version and a recreated version. It's relatively short because I can't spend too much time on this, but I'll go over a brief overview of this. So first, 2.1 is an introduction. This is the part where Galen introduces like the basic functioning parts of a body and how people interact with each other and like move and breathe and all of that. It's just an introduction. And then 2.2 section is hygiene. This is when Galen introduces how to maintain good hygiene by having good and bad humors, like moods, or preserving your health in general, like brushing your teeth and stuff. That's obvious. And then 2.3 is etiology, which is like studying on the causes of like symptoms. Basically, what he does here is he studies basically just the causes, and he focuses on Hippocrates, which is another Greek physician. 2.4 is semiotics, which is signs of diseases on affected parts of the body. He can know like about the pulse, internal pulse, or maybe just any visual signs of distress. And 2.5 is pharmacy. Obviously, this is where he talks about drugs and remedies are being how they're being created. 2.6 is the instruments of clinical practice. Obviously, this is how doctors use. This is the instruments doctors use to perform like operations. Mainly, he focuses on like bloodletting, which means just like emptying people's blood into a cup. And then 2.7 is therapeutics, which is like, the prevention of diseases and like just treating people. He talks about how like easy methods of like curing diseases, and he also refers to Hippocrates as a physician. So, yeah, that was the main attraction, the recreation, and here are some additional slides that I wanted to share. So here's Roman medicine. Here's a quick introduction. Although Roman medicine is unique in its own way, it is largely derived from Greek medicine. Many Romans had their own physician, and Greeks were able to bring their knowledge of the 5th to 4th century BCE with medical treatment into diet and surgery. On the main side is tools. I'm just going to be talking about some tools that surgeons used, like bone levers. These were used to pry out teeth and fractured bones, and cupping vessels for bloodletting, cuffs for letting out blood, obviously, and spatula probes were probes used to apply things like liquids and creams. And uvula forceps were just tools for crushing uvula to prevent a hemorrhage. And sharp hooks, as they are used presently, small hooks are used to pry objects like tissue for accuracy. In conclusion, I hope you guys enjoyed my presentation and my recreation and herb document. Thank you so much for listening.